The FSD Plus is a light and heat energy-based device for the treatment of improving the overall appearance of the skin. This is a guide to FSD Plus setup and treatment only. Please refer to the user manual for complete details, including precautions, warnings, contraindications, and device maintenance. Inside the box, you will find the Radiancy Facial Skincare Device, a power cord, quick guide, LUA, 5 disposable hygiene rings, and goggles. We recommend a pre-treatment test to determine the safest, most effective energy level for your client. Attach the power cord to the back panel. On the back panel, you will also find the fuse drawer. Once the unit has been turned on, the power and ready light will turn on. It will automatically be set on the medium treatment level. There are 3 energy levels on the device: low, medium, and high. On the low, the device will emit 5 sequenced pulses before automatically recharging. On medium, the device will emit 8 sequence pulses before automatically recharging. On high, the device will emit 10 sequence pulses before automatically recharging. There is no difference emitting 2 pulses on low, medium, or high. Before performing a pulse, make sure the LUA lamp is correctly in place. When inserted correctly, it will spring back when pushed. Put on a new hygiene ring, turn on the device, set the energy level, wait for the green light to light up, and ready to appear. Prior to treating the area, be sure to cleanse the skin. Make sure there is no acetone or alcohol in the cleanser. Dry the skin before treatment. Start on the jawline for the first pass. Press and hold the trigger button. If at any time during the pulse sequence the LUA feels too hot on the skin, immediately remove it and wait for the ready indicator light to come on again. Position the handpiece horizontally on the treatment area with the light source opening in full contact with the skin. Gently press the LUAs into the skin until you hear the ready beep, then press the trigger button. Make sure to keep the trigger button pressed. If you release the trigger button or move the LUA, the device will stop and recharge. During the recharging period, lift and hold the handpiece completely away from the skin. Apply the next sequence when the ready indicator lights up. Continue to repeat this procedure until the entire treatment area has been covered. Wait 5 minutes, then apply another pass with the handpiece held in the vertical direction. You can complete a 3rd pass on targeted areas. After all passes are complete, apply a moisturizer and sunscreen over the treatment area. To change LUA, grasp it by both ends and pull it out. To put in the new one, line up the posts in the LUA with the holes inside the socket and gently push it into place. When seated correctly, the LUA will spring back when pushed. The LUA on the FSD needs to be replaced every 80,000 pulses. The LUA on the FSD Plus needs to be replaced every 100,000 pulses. You will know when it needs to be replaced by the pulse counter on the top of the device. Document your client's progress with before and after pictures. Try treating the neck and décolleté with the FSD Plus for great results. You can even treat the hands. When treating the back of the hands, you might need to use shorter pulse sequence because the skin is more sensitive. For the first-time jitters, ease your client's anxiety by applying a few pulses on the hand before you start on their face. Once they know how it feels, they can relax and the treatment will go smoother. Not everyone can tolerate a complete pulsing sequence, especially during the first few treatments. Start your client off with 4 or 5 pulses, about half a sequence, and then work your way up. This is still enough pulsing to get great results. FSD Plus will not emit a ready beep unless you are pushing evenly. The best way is to press lightly without a lot of pressure. If there is no ready beep, adjust your pressure to one side or the other to make it even. Note, the 2 red lines on the LUA are also an indicator. Give the handpiece time to cool off between pulses. Make sure you hold it in the air and away from your client's face between pulses. If you hold it too close to the skin, it will not cool down properly and may preheat the treatment area. You should also try gently touching your client's skin on the pulse spot after each pulsing sequence. Your touch is comforting and will let you judge more accurately if the skin is getting too hot. The most common sensitive areas are the upper lip, the outer eye, the temple, and the sides of the neck. Be very careful when doing treatments on clients that have a history of cystic acne. Their skin may find the FSD Plus treatment too stimulating. Breakouts may occur. It may happen right away, after 3 or 4 treatments, or not at all. So keep an eye on these clients and stop treatment if they begin to develop cysts or break out. After all passes have been completed, put the energy level on high. Once the energy level is on high, you can tone the entire face by holding the handpiece in one hand and pushing the LUA back with the other. Hold it about a half an inch away from the face and scan across the entire face, both horizontally and vertically. This will give a nice final touch to the treated area. You can also drag the LUA up the neck, giving a tightening effect. For clients that receive 3 to 4 pulses, you can save time by using 2 hands and the high energy level so that you can treat 3 areas with a full sequence of 10 pulses.